Okay, this is the last chapter I'm going to cover. There are some total of 20. This is 21. There is the next one is 22 is on health. 23 is the epilogue or the summary of the book. And I've obviously chosen just a few of these and skipped many, but you can catch up if you want from the book. I'm not going to go deep into this chapter on lessons learned in 25 years of informing sectoral decisions with probabilistic climate forecasts. This is experience in South America with basically seasonal climate forecasts, what used to be called SEF, still called SEF. But some of the experiences are worth looking at before we go into health. The reader may recognize that what has been described so far closely resembles the elements required in a risk management system. So many people who do climate forecasts, weather forecasts, think of even climate change timescale projections as risk management issue. So comes down to cost benefit potential value of the forecast and the amount of money you are willing to put in to hedge against the risk. Okay, so that's framework is very economic approach and presumably can lead to better decisions. Institutional dimension, procedures, risk assessment and risk management is kind of the steps in the risk management system. Bateman proposes an approach to improve management of climate-related risks based on 4 pillars. Identify vulnerabilities and or potential opportunities due to climate variability for a given system, typically agriculture, water, energy, public health. These are the 4 broad umbrellas into which pretty much everything that human societies do can fit into. And this has to be done in close collaboration with the stakeholders, the idea of co-production that we talked about. Characterize, quantify, and if possible, reduce climate uncertainties to facilitate decision making in various socio-economic sectors. The associated information may include historical analysis, understanding the past, monitoring the systems, observing the present, and climate forecasts, predicting the future at different timescales. IRI, Lisa Goddard, and others have added that outcomes have also to be monitored so you can get feedback and fine-tune the systems, obviously. Identifying technologies and practices that optimize results in normal or favorable years, reduce vulnerabilities to climate variability and change, or both. Examples in agriculture include crop diversification, improved tillage, systems for increasing water soil storage, improved plant water use efficiency, and drought-resistant cultivars. So now you are going from doing predictions and looking for predictability and applications to agriculture to how then holistically manage agricultural system in the context of climate variability and change, and having metrics for vulnerability. Good work done there by many groups. Rob Wilby comes to mind, some Indian groups like Subankar Karmakar and so on, which then gives you a way to track vulnerability to crop selection, climate change, temperature variability, extreme events, and so on, and then try to reduce vulnerabilities with forecasts. Identifying policies and institutional arrangements that reduce exposure to climate hazards and enable one to take advantage of favorable climatic conditions. Exposure reduction can be achieved, for example, with improved early warning and response systems, and by transferring portions of the existing risks with various forms of insurance. So crop insurance can, for example, act as a very good tool for betting against risks and reducing vulnerability to the vagaries of climate, like extreme events, droughts, delayed monsoon onset, for example, cyclones, and so on, right? So we'll leave that there, then move into predicting climate impacts on health at subseasonal to seasonal timescales. This is a group with Madeline Thompson, Adrian Tompkins, who have had years of experience, Rachel Lowe, everybody here. who have done lots of work in Africa and South America and elsewhere on climate and health, and using climate predictions mostly as seasonal timescales. Again, S2S has not been as extensively applied yet to climate. To start with, you can start with very general figures like this, which show impact of climate change on human health. These are very useful, but to go directly from here to actually implementing early warning systems and adaptive management systems is not always that straightforward. So you look at weather elements like heat, rain, floods and storms and so on, and climate change, which includes temperatures, more extreme weather, rising sea levels, and increases in CO2, so air and water quality issues. And then they map onto severe weather, air pollution, changes in vector ecology, increasing allergens, water quality impacts, water food supply impacts, environmental degradation, and extreme heat. So the increased temperature increases the periods over which pathogens can grow, and then rain can just spread the pathogens around, increase diseases, vector-borne, waterborne, and then habitat changes can affect human contacts and then lead to epidemics like we are having with COVID. So in terms of health outcomes, you have injuries, fatalities, mental health. Mental health is now a serious issue when it comes to climate impacts. Asthma, cardiovascular diseases, malaria, dengue, encephalitis, hantavirus, Rift Valley, respiratory allergies, asthma, cholera, cryptosporidiosis, campylobacter, leptospirosis, malnutrition, diarrheal diseases, forced migration, civil conflict, mental health again, and health-related illnesses and death, cardiovascular failure. So people project these onto morbidities, mortalities, vulnerabilities based on socioeconomic status, education, per capita GDP, and so on, so that you can build a system to account for region-specific and social context in which early warning systems can be used to reduce vulnerability. Also labor loss, productivity loss, so that you can look at co-benefits of making health forecasts. We can zoom into timescales. This is heightened El Nino related health risks. I won't go through the details, but we know that El Nino shifts droughts and floods and storms and cyclones and wildfires and so on. So you have lots of direct and indirect impacts, vector-borne diseases, waterborne diseases, disruptive health services, respiratory diseases, and so on, and malnutrition as well, food security issues, communicable diseases, and so on. So El Nino is also shown to affect civil conflicts, even armed conflicts, and of course displacements of people internally and across borders, especially countries like Brazil, Peru, Chile, African countries, etc. NOAA provides this nice map of the 2015-2016 massive El Nino and how it elevated disease risks across the globe. So here we have hantavirus, plague, West Nile, chikungunya, dengue fever, malaria, chikungunya, dengue fever, respiratory illnesses, cholera, malaria, Rift Valley fever, cholera and malaria, chikungunya, dengue fever, respiratory illnesses, and so on. So we have talked already several times that El Nino has predictability at multiple month or multiple season timescales. The teleconnections can be predicted fairly well in terms of temperature, precipitation, impact on soil moisture, crops, and so on, and coastal waters, harmful algal blooms, pathogens, and they can be converted to empirical health forecasts. Okay, so we'll look at some specific examples and approaches in the next podcast, but you get the idea that health is a very rich sector in terms of predictable signals. You don't have to always know the details of the epidemiology itself, but can find statistical relations, as we will see, from environmental factors to causative agents, mosquito population, for example, or explosion in cholera, Vibrio cholerae in the waters, and so on, and then translate that to usable forecasts, weather and climate forecasts for health applications. As I said, not done very extensively in S2S yet, but you will see easily how S2S will help extend the horizons for decisions. Okay.